A pleasant day to all. For this discussion, I am going to talk about asepsis. So for an overview, when we say asepsis, this is the freedom from disease-causing microorganisms. So asepsis, ibig sabihin, we are free from bacteria, from virus, from any fungi or any other microorganism. So it is the absence of microorganism. And how do we do that? Through aseptic technique. So again, to decrease the possibility of transferring microorganisms from one place to another, gumagamit tayo ng aseptic technique. So mamaya pag-usapan natin ano-ano ba yung mga aseptic technique na yon. Okay, so the main point here is when we say asepsis, it is the absence of microorganism. Okay, so there are two basic types of asepsis. First is medical asepsis, also known as clean technique. So it includes all practices intended to confine a specific microorganism to a specific area, limit the number, growth, and transmission of microorganism. So when we say medical asepsis or asepsis or clean technique, ang principle nito is just we are just limiting or inhibiting the growth and transmission of microorganism. Okay, hindi natin totally ma-eradicate 100% yung microorganism. Our parang purpose lang is to definitely to limit lang, malimitahan or ma-prevent lang somehow yung pag-spread ng microorganism. Pero again, 100% or totally, we cannot eradicate microorganism. Now, on the other hand, when we say surgical asepsis, this is also known as sterile technique. It refers to those practices that keep an area or object free of all microorganisms. So ito, yung sterile technique or surgical asepsis, ito talaga, for example, the surgical field or an area is totally 100% free from any microorganism. So ito yung mga ginagawa natin para totally ma-eliminate 100% yung mga microorganisms. For example, commonly ginagawa to in the operating room wherein we perform procedures na naka-open, for example, yung certain body part ni patient. So we do not want to introduce bacteria sa open body part na yon or to our patient. So definitely, we are going to perform techniques para ma-ensure na 100%, for example, yung kamay mo is 100% or totally free of any microorganism. Okay? Tapos, we can also prepare an area, for example, na na wala talagang microorganism. So that is a sterile technique and common or also known as surgical asepsis. Commonly ginagawa siya in the operating room. And definitely may mga procedures tayo na ginagawa rin sa pasyente. Ang kailangan we are observing sterile technique. For example, inserting catheter to our patient. So definitely mag-insert ka ng object sa pasyente and we do not want to again to introduce microorganism to our patient, kaya we have to observe sterile technique in that case. Okay? So I hope clear yung two types of asepsis. So you have medical asepsis and you have surgical asepsis. Next, when you say sepsis, it is a serious medical condition caused by the body's response to an infection. So ito yung somehow life-threatening, if I may say, na response ng katawan natin because of an infection, okay? Because of a bacteria or probably a virus or any microorganism. So that is sepsis. Now we have after knowing the terms asepsis and sepsis, now we have another term here, nosocomial infection. So commonly maririnig nyo to as a healthcare provider. So when you say nosocomial infections, these are classified as infections that originate in the hospital. So, ibig sabihin, ito yung mga impeksyon na nagmula sa hospital. Ito yung mga impeksyon na, na nanggaling in the hospital. Okay? So, nosocomial infections can either develop during a client stay in a facility or manifest after discharge. So, ayan. So, commonly na-encounter natin yan if, for example, yung mga healthcare provider definitely ay hindi nagfo-follow ng ng mga techniques or practices to inhibit the transfer of microorganism. Kaya naman as a healthcare provider, as a nurse, kailangan we follow itong mga i-discuss natin later on para maiwasan yung pagkalat ng bacteria, viruses, or any other microorganisms to our patient. Kasi we do not want them to acquire any infection because of us. Okay? So that is nosocomial infection. Now, how do we prevent nosocomial infections? Ibig sabihin, ano-ano yung mga techniques or procedures na ginagawa natin para maiwasan yung pagkalat ng microorganism at ma-prevent definitely yung nosocomial infections na pwedeng mangyari sa ating mga pasyente. So the first one is hand hygiene. Again, ang unang procedure na or practice na i-discuss natin para ma-prevent or para maiwasan yung pagkalat ng nosocomial infection as a healthcare provider is hand hygiene. So it is considered one of the most effective um, infection prevention measures. So ito yung isa sa pinaka-epektibong paraan para maiwasan yung pagkalat or yung i-spread na ng microorganism sa ibang tao. So it is important for both the nurse and client's hands to be cleansed at the following times. So dapat hindi lang tayo, even sila patients or yung mga visitors of the hospital, we educate them how to or to we educate them to perform hand hygiene. So kailan tayo magpe-perform nun? Before eating, after using the bedpan or toilet. So after mo mag-CR, you perform hand hygiene, and after the hands have come in contact with any body substances such as sputum or drainage from a wound. So for example, ikaw nagte-take care ka ng isang pasyente tapos na-contaminate yung hand mo or nagkaroon ka ng contact with any body fluids, so you have to perform hand hygiene immediately. So for routine client care, vigorous hand washing. So ibig sabihin talagang um, ma mainam yung ating pag-hand washing under a stream of water for 15 to 20 seconds using granular soap, soap-filled sheets, or liquid soap at the beginning of the nurse's shift when hands are visibly soiled and after using the toilet, as recommended by the World Health Organization. So as a nurse, yon dapat lagi tayong naghuhugas ng kamay before the shift, after using the toilet, and kapag alam natin na yung kamay natin is madumi. So we have to wash our hands vigorously, 15 to 20 seconds. Okay, so ito naman, hand washing with soap and water may be inadequate to sufficiently remove pathogens. So sometimes after hand washing, we use alcohol-based antiseptic hand rubs, and that is recommended by the CDC or Center for Disease Control. Okay, so ito yung kumbaga after natin maghugas ng kamay, nagsasanitize pa tayo or nagdi-disinfect pa tayo using alcohol. Okay, so ito talagang mas may ensure natin na we can definitely inhibit the spread of microorganism. So we do that before and after each direct client contact, especially in this time of pandemic, di ba? So ito commonly ginagawa talaga natin to. We are using sanitizer or we're using alcohol every time na we come in contact, kahit kanino man, di ba? Or even if we come in contact with any objects na hindi naman talaga sa atin, so we disinfect immediately. And then CDC promotes the use of alcohol-based hand rubs because they kill bacteria more effectively and more quickly than hand washing with soap and water. So kung wala kasing, for example, hindi available yung soap and water, we can do or we can use alcohol based hand rubs. So itong nasa picture na 'to, 'di ba, commonly nakikita natin 'yan in public CR or even in bago pumasok ng mga malls, 'di ba? So ayan, we can use this if wala tayong access with water and soap. So they are less damaging to skin than soap and water, resulting in less dryness and irritation, and they require less time than hand washing with soap and water. So, napaka-accessible kapag tayo may hand sanitizer or mayroon tayong alcohol. Or so ito, bottles or dispensers can be placed at the point of care so they are more accessible. So in the hospital, bawat patient room we have sanitizer din na nakaabang or parang dispenser so that we can just dispense um, an alcohol or any disinfectant, and then ayun na, we clean our hands using that. Okay, so there are four techniques of hand hygiene. First is hand washing. Again, the four techniques of hand hygiene is number one, hand washing. So defined by CDC as vigorous brief rubbing together of all surfaces of lathered hands followed by rinsing under a stream of water for 15 seconds. So hand washing, we are just using water tapos mechanically um, kinakaskas lang natin yung kamay natin to remove microorganisms. So again, hand washing, we just use water in that sense, okay? In this type of hand hygiene. Water lang tapos nirarub lang natin mechanically yung hand natin. So that is hand washing. And again, it does not kill the microorganism. Tinatanggal lang niya yung microorganism in our hands because of the water, because of the stream of water. So natatanggal lang siya in our hands. But again, hindi namamatay yung bacteria or yung any microorganism if we are just performing hand washing. Again, hand washing means you just use water and your hands mechanically to remove microorganisms. So that is the first type, hand washing. So the second type is surgical hand antisepsis. So this one is performed by surgical personnel to eliminate transient and reduce resident hand flora. So ito yung ginagawa, ito yung parang hand washing performed in the operating room area or yung mga healthcare professional na papasok in the operating room at may gagawin doon or magpe-perform ng any procedure, so they have to perform surgical hand antisepsis or surgical hand washing. So ito talaga, it eliminates again microorganism 100%. Okay? So that is the second type. So the third type is antiseptic hand wash. So itong antiseptic hand wash, you wash your hands with warm water and soap or any other detergent containing an antiseptic agent. So kung yung hand washing kanina is just you use water and your hands mechanically to remove bacteria, yung antiseptic hand wash naman na to, we use now warm water or a tap water using soap or any antiseptic agent or detergent. Okay, so ito yung gumagamit na tayo ng sabon sa paghuhugas ng kamay. So that is antiseptic hand wash. So some antiseptic agents can kill bacteria and some viruses. So depende sa gagamitin nating sabon or antiseptic agent. So definitely it can kill microorganism. Okay, so this time kasi gumamit na tayo ng soap or antiseptic agents in washing our hands. So that is antiseptic hand wash. And then the last type, the fourth, is application of an antiseptic hand rub. So that is antiseptic hand rub product to the entire hand surface to reduce the number of microorganisms present. Example nito, ethanol base with 60 to 90% alcohol, or alcohol-based products are more effective for standard hand washing for unsoiled hands than regular soap. So for the antiseptic hand rub, gumagamit lang tayo, for example, ng mga alcohol, ng sanitizer, okay, in cleaning our hands. We do not use soap, we do not use water. Okay, so ito yung kaninang sinabi ko na mabilisan lang, okay, to clean our hands using an alcohol or any ethanol-based product, 60 to 90% alcohol. So definitely, again, effective din siya for unsoiled hands. So ibig sabihin, kung hindi masyadong madumi yung kamay mo, so you can use, pwede na yung antiseptic hand rub. Okay? So these are the four techniques of hand hygiene. So again, the first one is hand washing, wherein gumamit ka lang ng water and then yung kamay mo. Second one is surgical that is like surgical hand washing. So the third one is antiseptic hand wash. Dito ka gumamit ng soap, water, tsaka you wash your hands vigorously. And then yung pang-apat is antiseptic hand rub, wherein you just use um, alcohol-based product. Okay, or parang sanitizer. So that is the four techniques of hand hygiene. So definitely ang desirable sa atin dito as a nurse is itong antiseptic hand wash. And then after mo mag-antiseptic hand wash, pwede kang mag-antiseptic hand rub for using alcohol or sanitizer. Pero again, if you are an OR nurse, definitely you have to do a surgical hand washing. Okay, so yung antiseptic hand wash pala, it can also be called as medical hand washing. Okay, medical hand washing. Now, hand hygiene guidelines natin. When hands are visibly dirty and soiled, wash hands with water and soap, such as antimicrobial soap. So, kung tingin nyo na talagang soiled at madumi yung kamay natin, so definitely you have to wash your hands with water and soap. So, anti-septic hand wash. So, wash hands if exposed to spore-forming organisms such as Clostridium difficile or C. difficile. So that is a bacteria that can cause serious infection sa ating large intestine. So definitely, ayaw nating ma-spread to. So we have to really perform antiseptic hand wash or medical hand washing ang tawagin. Now, if hands are not visibly soiled, use alcohol-based waterless antiseptic. So again, kung hindi naman siya talaga madumi yung kamay nyo, you can just use sanitizer or alcohol-based product. Okay? Para malinis yung kamay. Okay? So, ito yung antiseptic hand rub na diniscuss natin kanina. So that is a time when you wash your hands. Now, meron tayong tinatawag na 5 moments of hand hygiene. So pag sinabing 5 moments of hand hygiene, ito yung moments kung kailan ka kailangang mag-perform ng hand hygiene such as antiseptic hand rub or medical hand washing or yung antiseptic hand washing. Okay, so first, before touching a patient, you have to wash your hands. Second, or you have to perform hand hygiene in general. Okay, second, before you clean or before you perform a clean or an aseptic procedure, so you have to perform hand hygiene. Okay, kung sterile aseptic technique yan, so definitely dapat you practice aseptic procedure. So later on, mas malalaman natin ano-ano ba yon. So again, before you perform any procedure to your patient, you have to wash your hands or perform hand hygiene. Third, after fluid exposure risk, such as for example, nag-insert ka ng catheter, tapos baka nagkaroon ka ng contact with the fluid of the patient. So definitely, you have to wash your hands. 4, after you touch your patient, perform hand hygiene. And then 5, after touching patient surroundings such as the bed or any objects belonging to the patient, you have to perform hand hygiene. So these are the 5 moments of hand hygiene kung saan as a nurse dapat alam natin kung kailan tayo nagpe-perform or ginagawa itong hand hygiene. So again, before you touch the patient, before performing a procedure, such as for example, itong paglalagay ng intravenous fluid, after body fluid exposure, after touching a patient, and after touching patient surroundings. So these are the 5 moments of hand hygiene. Okay, so after knowing those concepts, now we are going to discuss the medical hand washing return demonstration. So again, yung medical hand washing, this is like yung parang antiseptic hand wash na discuss natin kanina as a type of hand hygiene technique. Okay, so medical hand washing return demo. So ito na yung hand washing na ginagawa natin in the hospital using water, soap, and our hands to mechanically remove the bacteria or any other microorganism. So let us discuss itong i-re-rep ninyo or yung i-return demonstration nyo. You will perform this. You will be evaluated by your clinical instructor on how you perform medical hand washing. Kasi it's a basic skill na dapat we all possess as a nurse to prevent the spread of microorganisms. So what are the purposes of medical hand washing? To reduce the number of microorganisms on the hands, to reduce the risk of transmission of microorganisms to clients, and to reduce the risk of cross-contamination among clients. So na-discuss na natin kanina yan. Tapos to reduce the risk of transmission of infectious organisms to oneself. So ayon ang endpoint natin is we wanted to limit or inhibit the growth of microorganisms. We do not want to spread bacteria, viruses, fungi, or any other microorganism to our patient or to other people inside the hospital or to the patient na nagbibigay tayo ng care. Now, what are the equipments na kailangan nyo for your hand washing demonstration? Soap, warm running water. So, pwede na yung kahit tap water na lang. And then paper towels. Why warm? Kasi mas desirable to definitely sa atin and mas nare-remove niya yung mga excess oil in our hands. Mamaya, makikita natin yung reason or the rationale behind why we use warm running water. So these are the materials or equipment that you need in order for you to perform hand washing. So the procedure. So let's talk about the procedure. First, you have to assess your hands. Kailangan tignan mo muna yung kamay mo. Your nails should be kept short. So kailangan maikli lang yung kamay, hindi pwedeng mahaba. The World Health Organization guidelines prohibit artificial nails in all settings. So as a healthcare provider, bawal yung artificial nails. Okay, so what's the rationale or the rationale for this? Short natural nails are less likely to harbor microorganisms, scratch a client, or puncture gloves. Ayaw nating masaktan yung pasyente natin dahil sa haba ng kuko natin or masira yung gloves because of that long nails that we have. So, tsaka di ba may naiipit na mga dumi-dumi kapag mahaba yung kuko. So, we do not want that. So, remove all jewelry that you have. For example, you have a ring or any jewelry that you have na pwedeng makatama sa pag-hand wash mo, you have to remove them. Okay? So, although research is controversial, microorganisms can lodge in the settings of jewelry and under rings. So, removal facilitates proper cleaning of the hands and arms. So, baka rin kasi nga may microorganisms din na harbor yung jewelry mo. So, much better if you remove your jewelry such as ring, wristwatch, if ever na makakatama siya during your hand washing. Okay. Next, check hands for breaks in the skin such as hangnails or cuts. So, tingnan nyo, baka may sugat pala kayo sa kamay. So, what's the rationale? A nurse was an open source may require a work assignment with decreased risk for transmission of infectious organisms due to the chance of acquiring or passing on an infection. So, baka kasi may sugat ka pala, may breaks ka sa skin mo, tapos hawak ka sa pasyente mo, so there is a probability na makapag-transfer ka pa ng infection or any other ailments sa iyong pasyente. So, we do not want that. So, those are the things that you have to assess before you perform hand washing. tignan yung mga bagay na yon. So let's now proceed to the procedure. So number one, if you are washing your hands, where the client can observe you, introduce yourself, and explain to the client what you are going to do and why is it necessary. So definitely establish rapport, ganun pa rin, and then paliwanag mo sa pasyente what are you going to do. Okay? Kung nandoon si pasyente. Okay, so next, turn on the water and adjust the flow. So buksan mo na yung water, for example, yung pumunta ka na sa sink and then adjust mo yung flow ng water. So there are 5 common types of faucet controls. So depende sa inyong hospital na faucet na ginagamit. So we have operated handles, yung ginagamitan natin ng kamay just like this para mabuksan yung faucet. Second, you have knee levers, yung pwedeng tamaan lang or gamitin lang natin yung knees natin or knee para magbukas yung water, yung faucet. So that is knee lever. Knee levers, faucet. Foot pedals, just like this one. Inaapakan natin yung parang ito, yung pedal para magkaroon ng flow ng water, yung faucet. And then elbow controls, this one. So we use our elbow para bumukas yung tubig. So you move this with elbows instead of hands. Although pwede naman yung hands, pero again, pag elbow, pwede siyang makontrol ng ating elbow. And then infrared control, kung siya ay the motion in front of the sensor causes water to start and stop flowing automatically. So ito yung mga automatic na faucet or gripo na meron kayo in the hospital. Pero since you are just at home, kung ano na lang yung available na faucet that you have, that would do. So yun yung i-open ninyo to wash your hands or gagamitin nyo in your hand washing. So adjust the flow so that the water is warm. Kung meron ng adjustment for the temperature, so you do that. Pero kung wala tayong magagawa. So just let the water flow. Okay? So the rationale kung bakit warm water yung mas maganda because warm water removes less of the protective oil of the skin than hot water. So yun yung reason why warm water yung desirable. Okay? So next, number 3, wet the hands thoroughly by holding them under the running water and apply soap to the hands. So basain na yung kamay and then, ayan, apply soap to the hands. So hold the hands lower than the elbows so that the water flows from the arms to the fingertips. Why? Because the water should flow from the least contaminated to the most contaminated area. The hands are generally considered more contaminated than the lower arms. Note that this is a different technique when performing surgical hand washing. So for medical hand washing, ang ginagawa natin is yun na nga, your hands are lower than your elbows because definitely mas contaminated yung hands natin than the lower elbows. So just like this one. Okay, so this is how we perform medical hand washing. So, mas mababa yung hands and then ito yung ating forearm in this case. Okay, so ayan. So, kumuha na ng soap tapos mag-wash na ng hands using soap. Now, if the soap is liquid, apply 3 to 5 ml or 1 teaspoon. If it is a bar soap, granules or sheets, rub them firmly between the hands. So, ayan, ganyan. Siyempre, alam naman natin kung gaano yung amount na gagamitin natin. Okay? For hand washing. Okay, number 4, thoroughly wash hands and rinse the hands. So, after that, so ito, use firm rubbing. Ito yung how you rub your hands using the soap. So use firm rubbing and circular movements to wash palm, back, and wrist of each hand. So be sure to include the heel of the hands, interlace the fingers and thumbs, and move the hands back and forth. So this is while you have the soap in your hands, okay, or yung liquid soap. So, kailangan nire-rub nating mabuti. Okay? Circular movements. And then, take note of the areas, palm, back, and wrist of each hand. Tapos, ito yung mga specific. So, right palm over left dorsum with interlaced fingers and vice versa. Palm to palm with fingers interlaced. So, just like this one. Backs of fingers to opposing palms with fingers interlocked, and rotational rubbing of left thumbs clasped in right palm and vice versa. So you do this, continue this motion for about 20 to 30 seconds. So gagawin nyo to, yung procedures na to, okay, for 20 to 30 seconds. So the rationale, the circular action creates friction that helps remove microorganisms mechanically. Kaya mahalaga yung friction na ginagawa natin with our hands. So interlacing the fingers and thumbs cleans the interdigital spaces. So para ma-ensure natin na lahat ng areas, lahat ng spaces in our hands are thoroughly cleansed. And then the nails, rub the fingertips against the palm of the opposite hand. So yung ating fingertips din, dapat nire-rub natin against the palm of the opposite hand because nails and fingertips are commonly missed during hand hygiene. So para matanggal din yung mga microorganisms na naka-lodge doon. So we have to do that. And then rinse the hands after doing these things na sinabi natin. Okay? I will send to you a video para makita nyo kung paano ginagawa itong mga aspects na to in hand washing. Okay? So, tignan sa video kung paano siya gagawin. So, after that, so number 5, thoroughly pat dry the hands and arms. So, tapos ka na mag-hand wash, so definitely tutuyuin mo na. So, dry hands and arms thoroughly with a paper towel without scrubbing. Moist skin becomes chapped readily as does dry skin that is rubbed vigorously. So, chopping produces lesions. And then discard paper towel in the appropriate container. So, after using them. And then turn off the water. So, how do you turn off the water? So, use a new paper towel to grasp a hand-operated control. So, gagamit kayo ng another paper towel para patayin yung faucet ninyo. This prevents the nurse from picking up microorganisms from the faucet handles. Kasi kakalinis mo nga lang, di ba? Kaka-hand wash mo lang. So, definitely you have to use, for example, a tissue or a towel para ipang turn off doon sa hand-operated control ng inyong faucet. Okay, so that is how you perform your hand washing. Now, we have here a performance checklist for medical hand washing. So it's almost the same sa diniscuss natin kanina. So this is how you will be graded in performing your medical hand washing. So make sure na you perform all these tasks to get a complete or a perfect score of 5. So pag may na-miss kayo, definitely mababawasan yung score nyo. So in your return demonstration, you have to perform this step-by-step procedure. Kailangan makita namin na you perform all these steps. Again, if you miss anything, then you will get deduction for that. So make sure, I will give you a copy of this. Okay, so that is for the hand washing. So that is the first way to prevent nosocomial infections in the hospital, hand hygiene. And part of hand hygiene is hand washing. So the second way to prevent infection, nosocomial infection, is the infection prevention and control. So we have these guidelines for every institution. We have this infection prevention and control. So because it's not always possible to know kung sino yung client natin na may na may microorganism or have infectious organisms, so a set of guidelines has been established by the CDC. So we must follow to reduce the chances that organisms in blood and potentially infectious organisms from other tissues will be transmitted from the client to other individuals. So ito yung ginagawa natin. Okay, para tayo ay maprotektahan even yung ating mga pasyente. So we have here the isolation guidelines contain a two-tiered approach. So again, yung isolation guideline, which is part of the infection prevention and control, meron tayong dalawang approach or approaches. First one is the standard precautions or SP kung tawagin, standard precautions. And the other one is transmission-based precautions. So remember this. Ano? So again, we have two isolation guidelines to contain two isolation guidelines or approaches. So you have standard precautions or SP, and the other one is transmission-based precautions. So let us first discuss standard precautions or SP. So this is the first tier. Some agencies may use an earlier term na tinatawag nilang universal precautions. So ito yung term na ginagamit dati. Baka ma-encounter nyo lang. So universal precautions or standard precautions. So it's just the same. Because standard precautions or universal precautions reflecting their applicability in all client care situations. So regardless kung anong ginagawa mo sa iyong pasyente, applicable siya, yung standard precautions na to. So healthcare professionals use standard precautions when providing care to all clients. So lahat ng pasyente, kahit sino or kahit ano pa man siya, we use standard precautions. And what are the standard precautions? Hand hygiene and use personal protective equipment or PPE such as gloves, gowns, masks, eye protection, and face shields. So later on, mas makikita natin what are these. Okay, so standard precautions are used in the care of hospitalized individuals regardless of their diagnosis. So they are used in any situations involving blood or all body fluids, excretions, and secretions except sweat, non-intact skin, and mucous membranes. So ano-ano yung mga kasama sa ating standard precautions, just like what I have mentioned kanina, hand hygiene. So yung diniscuss natin. Second, use of personal protective equipment or PPE, which includes gloves, gowns, eyewear, and mask. Safe injection practices, so that is part of SP. Safe handling of potentially contaminated equipment or surfaces in the client environment, and respiratory hygiene or cough etiquette. Cough etiquette, kapag umubo ka, ano dapat yung measure na gagawin mo para ma-prevent yung spread ng microorganisms. So that is cough etiquette. And as a nurse, dapat alam nyo how to perform that. Okay, so dito, I just included here the standard precautions, lahat ng inclusion of the SP. So I will just leave it to you guys for your additional reading. Okay, so please read this one, all the guidelines stipulated for the SP. So again, standard precautions are designed for all clients in the hospital. So that is the standard precaution. So I just gave you an overview. Next, the second one is transmission-based precautions. For transmission-based precautions, if the client is known to have an infection, ito yung second tier na ginagamit. Okay, to protect the nurse and others from acquiring the infectious organism. Kung alam natin na sa pasyente ay may infection, so we use the transmission-based precautions. So these precautions are used in addition to SP. So ginagamit natin itong transmission-based in addition to standard precaution. So gagamitin muna natin sa SP, and then afterwards, we also adhere to transmission-based precautions. So it's like an additional measure that we take para maprotektahan tayo. Kasi nga, our client is having an infection. Okay? So, ano to? So, when those precautions do not completely block the chain of infection and the infections are spread in one of three ways. So you have airborne, droplet transmission, or by contact. So ito yung mga ginagamitan natin ng transmission-based precautions, and for each way, meron tayong specific guidelines. So let's focus first. Ito muna, definition lang ng isolation. So when we say isolation, it refers to measures designed to prevent the spread of infections or potentially infectious microorganisms to health personnel, clients, and visitors. Okay, so meron tayong two types of isolation. You have category-specific and disease-specific isolation precautions. So pag sinabi natin category-specific isolation precautions, meron siyang 7 categories. You have strict isolation, contact isolation, respiratory isolation, tuberculosis isolation, enteric precautions, drainage secretion precautions, and blood or body fluid precautions. So again, yung paggamit nito will depend kung sino yung patient na hinahawakan natin. If, for example, may TBC patient, so we adhere to tuberculosis isolation. If the patient has respiratory problem, so respiratory isolation tayo. So that is category-specific isolation precaution. Second one is disease-specific isolation precaution. Provide precautions for specific diseases. So these precautions delineate use of private rooms with special ventilation. Having a client share a room with other clients infected with the same organism, and gowning to prevent gross soilage of clothes for specific infectious diseases. So these are the types of isolation. But our focus here is the transmission-based precaution. So balik tayo sa ating 3 types or 3 na measures under transmission-based precautions. First one is airborne precautions. So when you say airborne precautions, these are used for clients known to have or suspected of having serious illnesses transmitted by airborne droplet nuclei smaller than 5 microns. So this is again, yung nuclei ng microorganism, yung kanyang airborne droplet is have smaller than 5 microns or less than 5 microns. Examples of such illnesses na pwedeng ma-transfer through airborne includes measles or rubiola, varicella, including disseminated zoster, and tuberculosis. So again, if our patient is having this kind of situation, so airborne precautions yung ginagawa natin. Mamaya I'll show you kung ano-ano yun, kung ano-ano yung air precautions na yun. So pag droplets naman, used for clients known to have or suspected of having serious illnesses transmitted by particle droplets larger than 5 microns. So yung kaibahan sa airborne, yung airborne, maliit lang siya, less than 5 microns. Yung droplet, larger than 5 microns na. Okay, so examples of such illnesses are diphtheria, mycoplasma pneumonia, pertussis, mumps, rubella, streptococcal pharyngitis, pneumonia, or scarlet fever in infants and young children, and pneumonic plague. So if that is the case of your patient, then you observe droplet precautions. And then the third one is contact precautions. So these are used for clients known to have or suspected of having serious illnesses easily transmitted by direct client contact or by contact with items in the client's environment. So ito yung mga sakit ni patient na pwede natin makuha if directly mako-contact natin siya or directly makakontact tayo sa ginamit niya. So according to CDC, such illnesses includes GI, respiratory, skin, or wound infections, or colonization with multi-drug resistant bacteria. Okay, so I will read the rest of the reading sa inyo. If your patient, if you are going to handle patients such as this one, ayan, yung may mga infected ng Clostridium difficile, enterohemorrhagic E. coli, Shigella hepae. So, contact precautions tayo. Okay, yung ating i-observe. Okay, so dito, ito na. Ito na yung mga specific precautions nila. So, binigay ko yung background about airborne droplets and contact precautions. In the succeeding slides, ito na pinapakita ano yung mga yung mga measures na kailangan mong gawin for these precautions if you are going to handle this kind of patients. Okay, so I will leave the rest of the reading sa inyo. For the comprehensive reading, pakibasa na lang. Pero this one, ito yung summary of airborne precautions. So again, if you are going to observe airborne precautions, everyone must or you must clean your hands, including before entering and when leaving the room. Put on a fit-tested N95 or higher level respirator before room entry Remove respirator after exiting the room and closing the door. Door to room must remain closed, and airborne precautions will also include the negative pressure ventilation or HEPA filtration. So these are the guidelines for airborne precautions. You have to adhere to this if you will be handling patients with um, na pwede mong makuha yung infection or microorganism through airborne. And then for droplets, ganun din. I mean, makibasa rin yung the comprehensive discussion, and then ito naman yung kanyang summary for droplet precaution. So iba yung definitely yung guidelines or yung measures that you have to follow for droplet precautions. So please read this. Ito siya. And then for contact precautions, so again, please, what are the guidelines or the things that you have to know. And then ito naman yung for Ayan, ito yung for contact precautions. Ito yung dapat mong i-observe. If you will be handling patients na pwede kang mahawa ng infection through direct contact. Okay, so those are, ito yung dalawang tier na tinatawag natin for infection, prevention, and control. The first tier, again, is the standard precaution. And the second tier is the transmission-based precaution. For transmission-based, we have three types. You have airborne precaution, you have droplet precaution, and you have contact precaution. So please, again, comprehensively read the PowerPoint. I will be giving this to you. Now, for isolation practices, so initiation of practices to prevent the transmission of microorganism is generally a nursing responsibility. So we have to assess the status of our client's normal defense mechanism, the client's ability to implement necessary precautions, and the source and mode of transmission of the infectious agent. So the nurse then decides whether to wear gloves, gowns, masks, and protective eyewear. So ito yung standard precautions. Ito yung kabilang sa standard precaution, di ba? So again, in all client situations, nurses must cleanse their hands before and after giving care. So for isolation practices, we use PPE, and a part of your checklist dapat is how to don gloves, kahit clean gloves lang, and how to wear or don din ng gown, mask, eyewear. Pero again, ang required lang sa atin is yung hand washing. So we are going to skip on this. Okay, so for the PPE, as part of the isolation practices, again, first we have PPE, or ang isa sa ating i-discuss is the personal protective equipment. And under PPE, we have gloves. So gloves, these are worn for three reasons. First, they protect the hands when the nurse is likely to handle any body substances. So I'm sure na nakakita naman na kayo ng gloves, right? Second, gloves reduce the likelihood of nurses transmitting their own endogenous microorganisms to individuals receiving care. So you are protected. Yung una, it's for you to be protected to your patient. Yung second, for your patient to be protected from you. And then yung third, gloves reduce the chance that the nurse's hands will transmit microorganisms from one client or an object to another client. So gumagamit tayo ng different glove or different gloves when we take care of different patient, definitely. So dapat we use a new pair of gloves kapag we are handling a different patient. So new gloves for each patient. So latex gloves lubricated with powder or cornstarch are particularly allergenic because the latex allergen adheres to the powder, which is aerosolized during glove use and inhaled by the user. So as a healthcare provider, you should be wary kung ikaw ay may allergy with latex. So baka ma-allergic ka with the gloves na gagamitin mo in the hospital. So you have to take note of that. So meron tayong latex allergy na pwedeng mangyari because of using the gloves, because the gloves that we are using consist of latex. Next, we have gowns. So I'm sure you know what a gown is. So it's a clean or disposable, impervious, water-resistant gowns or plastic aprons. These are worn during procedures when the nurse's uniform is likely to become soiled. So para maprotektahan yung ating uniform. So sterile gowns may be indicated when the nurse changes the dressings of a client with an extensive wounds. So kung medyo maraming, or I mean kung medyo serious yung wounds ni patient tapos may drainage, so you have to wear your gowns. Baka makontaminate yung iyong suot. Single-use gown technique is the usual practice in hospitals. So after the gown is worn, the nurse discards it or places it in a laundry hamper. So depending on your institution. And then face mask naman. So face mask, alam nyo na to, since you are wearing this, it is time of pandemic. So these are worn to reduce the risk of or transmission of organisms by the droplet contact and airborne routes and by splatters of body substances. So the CDC recommends that masks must be worn by those to the client, by those close to the client if the infection is transmitted by large particle aerosols are transmitted by close contact and generally travel short distances, so about 1 meter or 3 feet. So by all individuals entering the room if the infection is transmitted by small particle aerosols. So small particle aerosols naman remain suspended in the air and thus travel greater distances by air. So definitely we use masks if we, given this kind of situations. So yeah, so single use of disposable surgical masks are effective for use while the nurse provides care to the patient. So disposable lang yan if disposable lang yan tapos once lang natin siya gagamitin. So that talagang maging effective yung paggamit natin. So sometimes kasi yung iba longer ginagamit yung face mask. Okay, so hindi na nagiging less effective na yun definitely, mas nagiging contaminated na siya. So, disposable particulate respirators of different types may be effective for droplet transmissions, splatters, and airborne microorganisms. Currently, the category N respirator at 95 efficiency, referred to as N95 respirator, meets tuberculosis, SARS, and influenza control criteria. So ito yung ginagamit ng ilan sa atin, okay, in this time of pandemic para totally they are protected from COVID-19 virus. Okay, kung droplet man yan or airborne man si COVID, di ba? Yung mga scientists natin, some says na airborne, some says na droplet. So, itong N95 respirator, it can definitely protect you from the virus that we have right now. So N95 respirator. So I'm sure nakagamit na rin kayo niyan. So ginagamit din siya sa mga tuberculosis, influenza. Okay, and then you have eyewear. Protective eyewear such as goggles, glasses, or face shields and masks are indicated in situations where body substances may splatter the face. So if the nurse wears prescription eyeglasses, kung may eyeglass si nurse, goggles must still be worn over the glasses because the protection must extend around the size of the glasses. So those are the personal protective equipment. So itong huling slide ko is just like an additional information. So we have the term reverse isolation. This refers to the practice of healthcare workers and visitors wearing barriers, such as gown, gloves, or mask, routinely upon entry to the client room for the purpose of preventing client exposure to external microbes. We want to, here in this case, si patient kasi is maybe suffering from a very serious illness. Okay, compromise, immunocompromised yung pasyente natin. We use this isolation, reverse isolation. So, kung talagang severely sick si pasyente, such as, for example, HIV patient, okay? So, what do you need? Private room closed at all times, disposable gown, mask, gloves if with direct contact, hand hygiene, and then no plants and flowers in the room. Okay, so that concludes my discussion. So I will give you more information when I see you during our meeting, our online meeting. So thank you for listening and God bless.